Good afternoon and good morning, everyone. This is Eric Maston, Director of Public Policy with the National Network for Youth. We'd like to thank you for joining us for today's webinar on the Youth Assessment and Prioritization Tool. We're really excited to be able to partner with our friends from north of the border to bring this presentation to you today. A couple of housekeeping items. One, all attendees are in listen-only mode. We will go ahead and open time for questions and answers later. If there's anything that you have as a burning issue, please go ahead and use the chat box and go to webinar. We will be recording this presentation and sharing it to folks who are not able to join us afterwards. So please note that everything is being recorded. With that, I'm going to go ahead and turn things over to Darla Bardine, Executive Director of the National Network for Youth, for a brief introduction. And then we'll be handing it over to David French, Director of Policy with AwayHome Canada, and Wally Check, the Youth Assessment and Prioritization Tool author with Walron Psychological and Assessment Services. Darla?
Thank you so much, Eric. And thank you all for joining us. We are here at the National Network for Youth are so excited to have David and Wally join us. We have really appreciated our partnership with AwayHome Canada and the Canadian Observatory on Homelessness as we've been sharing ideas, resources, tools, knowledge across our borders for several years now. What we've been hearing loud and clear here at the National Network for Youth and what folks have been hearing in Canada from service providers is there really is a desire for a tool that communities could use that was really built for young people, but also allowed for communities to and experts who are administering the tools to have kind of their expertise input taken into account as well. We've also been hearing from service providers across the country a little bit of dissatisfaction with the existing tools that are available for communities to use when it comes to assessment and prioritization. So we have been very passionately tracking this work in Canada, somewhat stalking, for whenever this tool would be released, and we could ensure that it was shared with you all here in the U.S. So we are super excited. Thank you all so much. And without further ado, I am going to hand it over to David French, Director of Policy at AwayHome Canada.
Great.
Excellent.
Thank you, Darla. And David, please go ahead.
Thanks, Darla and Eric. It's a great opportunity for us to not only connect with our stakeholders south of the border, but also sort of demonstrate sort of where this work needs to continue to evolve in shared partnerships and shared collaboration. And so this is fun and an opportunity to also sort of build this learning curve with respect to assessment and prioritization tools that we need to have specifically around young people. As Darla and Eric identified, I'm the Director of Policy and Planning with AwayHome Canada. I'm currently on a 2-year leave from the Alberta government, where I spent the majority of my time in government sort of carrying the youth homelessness portfolio and led the development of their provincial plan to prevent and reduce youth homelessness, and then worked on implementation. And Wally and I go way back with respect to the development of that youth plan. Actually, we go so far back that one of the initial schematics that Wally had designed through our consultation process to design that youth plan still resonates within that work. And so, yeah, we've got a long-standing working relationship, and I'm eager to continue to work on that. Now they're in new roles. So a bit of context with respect to the webinar today. What I'm going to go through is sort of the strategic direction, alignment with respect to AwayHome, the national opportunity that the app tool is giving us, but then also the opportunity that it is providing us to think about application within different sectors and not just the youth serving homelessness sector. Wally will go through a much more of a broad sweep with respect to how the tool was developed, so the ongoing work that happened within the Alberta government with Wally, and then as it's continued to evolve. And then, of course, we're going to open it up to Q&A at the end. For those of you that don't know, AwayHome Canada is a national coalition that is aiming towards the development and sort of application of resources and tools that can affect policy, programs, and practice across Canada to subsequently end youth homelessness in Canada. AwayHome was formed about 2.5 years ago, and this key constellations of activity diagram, while it's slightly outdated, articulates the importance of where this YAP tool falls within the suite of activities that AwayHome Canada is leading. And so the youth tool is very much built on these key elements of supporting ongoing relationships with government, direct application to programs, a solid research and evidence base, the opportunity to engage young people and listen to their needs and address their concerns. Again, across Canada and within some work that Wally will go a bit deeper into, the emphasis on partnership and collaboration, and then the opportunity also for this to inform community planning. But then also this thinking that, no one tool is going to solve the issues that we are presented with, but also the fact that we're offering up a tool that can sort of fill some gaps, I think is an important step forward. Need to draw connection to the ongoing partnership we have with the Alberta government. As I said, I'm on leave from the Alberta government for 2 years to support AwayHome's policy and planning efforts. The work that was led off of my desk with respect to the Alberta government around the provincial youth plan and the specific elements that were identified within that youth plan around the development of a needs risk assessment tool. As Darla identified, community and stakeholders are continuing to articulate they need a youth-specific tool, and we heard that loud and clear as we developed the provincial youth plan, that community stakeholders were feeling like there was something missing from how they were determining and assessing young people's needs. And Wally will go into the backstory on how we came together and the partnership was developed, but at the end of the day, this work is supported by provincial policy in Alberta, and that has given us the foundation for continuing to move forward. And as you've probably seen this diagram before, but this is where the work fits within our pursuit of system and policy change. And you'll see that, across the prevention continuum and across the continuum that supports young people to transition out of homelessness, but then also this system that exists and exists in every community around our emergency response, it only makes sense that if we can bridge all three of those systems with one tool, there's opportunity for the tool to be sector forming as well. As sort of the project lead and leading implementation in Alberta, I recognize that there were dynamics in communities that would lend themselves to really solid partnerships, but there were also dynamics in those communities that led to really insular work. And the opportunity of building a tool around what community needs to then best address the needs of young people, but then also use that tool as an opportunity to bring community stakeholders closer together was really exciting to me. And the work with Wally has helped shape this thinking around it isn't just a tool, and Wally will get into this, it isn't just a tool for assessing young people's needs. It's a tool that could allow us to think about a no wrong door philosophy for young people, where they could approach a door of a service provider and that service provider could assess their needs and then move them on to the right service provider if they weren't the right one. And I think that's an important step forward in system planning as we think about community plans and statewide plans or provincial plans, and thinking about how we support the best outcomes for young people. This work fits squarely into our data dashboard with respect to how we can think differently about data and enumeration and research and how we can demonstrate progress moving forward with respect to youth homelessness in Canada. So the data dashboard was developed and really sort of fits within the thinking around how do we better understand the issues related to youth homelessness? How do we think differently about enumeration? How do we look at data management and the opportunities with data management and data sharing and case management and shared outcomes, to then think differently about how do we engage our not only our provincial and federal partners, but our municipal partners around funding and harmonized work that needs to happen across the country at all levels of government, so we can ensure that we can move the needle on this issue. And then another opportunity to inform shared performance measures. And the work around this assessment tool fits within this data management bundle around the data dashboard, and where we need to look at specific youth-focused, strength-based assessment tools that can determine not only a young person's risk of homelessness and their risk of long-term homelessness. Because again, we want to embed this tool into thinking around, it can be applied before a young person experiences homelessness so that we can prevent it from happening. But also we can use this tool once a young person finds themselves homeless and really shorten that experience for them as we move them into the right services and supports. And so, as a policy geek and someone who's really focused on data, I think there are really, really positive implications for the application of a tool of this kind. And so those applications and those positive implications focus on, as I said before, the knitting of systems together and working better together to support one individual young person. The opportunity to think about how we report and how we report into systems, but also into funders, how this tool can weave itself into existing systems and assessments. We know that there are assessments that are grounded and cemented in communities, and the opportunity that the app tool presents is this bridging of those existing assessments and the partnership of developing sort of shared methodologies with respect to assessments. But then also, now this is sort of a Canadian term, CBO or CE connection, community-based organizations or community entity connection, around how do they then apply the app tool across a system to better address the needs of young people in their community. The connections for policy and practice here too, and again, bridging back to where we started with respect to the partnership around this tool with the provincial youth plan, was we saw the need for a tool that could be applied across a number of systems to then better inform the work that needed to happen at the community level. And so we see this as a tool that can have broad implication. It's a way for us to think about harmonizing data systems and data sources. So whether it be at the state and the national level or the provincial and national level, but then also at the community level. This does provide us with this opportunity to integrate community planning and the planning that needs to happen around an adult and a youth system, which is that constant tension and dynamic in communities around where does a youth system of intervention end and where an adult system of intervention begin. And there can be shared opportunities within this tool for that. But then also, the tool is a shift in our approach. Maybe not in your approach. I shouldn't say that, because as we've learned, community organizations across Canada and in the States have been functioning from a strengths-based perspective for a really long time. And they've been addressing young people's needs from a strengths-based perspective for a really long time. And the beauty of this tool is that the tool is sort of mirroring how you've been working with young people and how you've been addressing the needs of young people within your organization and within your communities from a resiliency and a strength-based focus. And so that's the shifted approach that the tool is providing us with. And I'm eager to sort of capture those learnings along the way. And then again, it's just continuous improvement. How do we think differently about ensuring young people have unique needs? They have unique system interactions, but then they also have a unique way of responding to the services and supports that are provided to them. And overall, that uniqueness taught us and told us that a unique tool and a dedicated tool for young people was necessary. So that's it for my section. I'm gonna do some magic here and turn it over to Wally. You can probably start talking, Wally, if you want. And where is it again?
I think I got it.
Oh, you got it?
I think so. You see
Okay.
my slide there?
Yeah.
Okay.
Very good.
Awesome. Thanks, David. Darla, I wanted to say, you talked about this stalking idea. I was wondering who those people were standing behind trees with cameras that I started to see in the last few months. Mm-hmm. So obviously now I know that was you or your team or whoever, but I also have to say I'm excited about this opportunity today because I am an American citizen. I grew up in Montana, and so it's nice to be able to have another connection back to the U.S. Even work-wise. So I'm excited about that. So yeah, that was a great sort of opener that David provided, and he really. I don't think he, sort of gives himself enough credit for the work that he's done in the province of Alberta, but also now across Canada. There's not a lot of people from sort of that policy world that I think has as much actual passion for the work as David French does. So I've appreciated the working relationship I've had with him. But let's talk a little bit more about the YAP tool. And one of the things I want to share with you right off the bat is that this tool has ended up being something that there's an interesting phenomenon that's happening. The more and more that I train on it, the more I hear people say that they're wanting something different, as Darla had mentioned, but at the same time, when they learn what this tool is about, they love it, but there are challenges that come with it for them because this is a different way to do assessment for youth. And I hope that enough of that comes out in the little bit of information that I'll share. But it's been a great thing, and when people wrap their heads around it, I see that they're sort of falling in love with it. So I'm excited about that. But let me tell you a little bit about this. And I also wear a couple of different hats. I was with there's a city in Alberta by the name of Lethbridge. It's about 100,000 people. And prior to the work that I do now, when David and I first met and started working together, I was the housing first specialist for that system of care in dealing with homelessness. And my job was the clinical and operational supports for all of our funded Housing First programs. But it'll be 2 years in May that I started a new role with the Canadian Alliance to End Homelessness, which is the NAEH counterpart, as the director of training for our training and technical assistance program. And but that is a different role. That is a different hat. Even when I began the work on this assessment tool, when I was with the city of Lethbridge, it was something that I did in my time sort of outside of my city work, but yet the city supported me in doing that because it was something that we wanted to incorporate into our youth housing first stream. So that's just a little bit of background on myself. I also, the Walron Psychological and Assessment Services is there because I also have a consulting and private counseling practice that I do. And that's what the YAP work is based under. So the context of how this began in Lethbridge, Alberta, we went through a process of creating a separate youth stream. And so we use a centralized intake system for our coordinated entry. And we had a single centralized intake program with a mobile component and all the various aspects of that. But through research, and some of it was very specific to our region, we were able to determine that in the area of youth homelessness, we needed to have a separate system. I mean, the two systems work collaboratively, but we needed to have a separate intake option for youth coming into the experience of homelessness in whatever that way that looked. And so we had an organization called McMahon who ended up with the contract to provide centralized intake services there, and it was called the Youth Hub. And we were, of course, using an assessment tool and had a specific intake and assessment process. But we were experiencing some challenges, and I think very similar to some of the challenges that Darla was speaking about. We were struggling with various things, which you'll see here. The tool that we were using, and I think this is a really important point, that it was not a specific tool for youth or based on youth research. Initially, it was an adult tool that we were using. And then later on, essentially an adult tool came about with some adaptations to be able to accommodate the youth that people were working with. That to me still isn't the same as a tool that is specifically geared towards youth and was done so purposefully. A lot of what the tool was looking at was the deficits associated with people experiencing homelessness, how close they are to mortality, the challenges, the complexities that they face, the problems that they're experiencing. And as well, a big factor was chronicity. And what we know when we look at youth homelessness and why we need to assess youth differently than adults is that some of those factors just don't exist. A lot of youth haven't even been alive long enough to be sort of labeled under that chronically homeless definition. Most youth, I'm not going to say all because some definitely do, but most youth are not going to be facing at that point in time the chronic health issues that a lot of the people who are homeless in the adult world face. And most youth aren't a big drain yet on the system in terms of costs financially, and even there's a lot of service use. And part of that is because youth have a tendency to stay hidden in their homelessness and don't even necessarily like to identify themselves as being homeless. So we weren't capturing the pieces that were more youth specific well enough. And also as a result of that, we had youth that were being quote unquote screened out of our systems that most of the people involved knew that they were appropriate, knew that they needed to be provided an option for further case management and more intense supports, but they were being screened out because they weren't necessarily fitting some of the tick boxes that were associated with the existing assessment process that we had. And the scoring that was at play didn't seem to be capturing the youth circumstances as well as we thought it could. And there didn't one of the problems that we faced was that the people doing the assessments would do them. The assessment tool would tell them that they're not eligible or appropriate for our Housing First programs or whatever. But yet the people doing the assessment could tell you, but I know that there are other things there. There are other factors that are associated with the situation that for whatever reason we can't capture in the tool. But yet they didn't feel like they were allowed or that it was appropriate for them to use their own insight at all and provide that kind of information. So those were the core challenges. And so I began to kind of do some research and focus on what could we do differently? And I looked at multiple places, and Darla mentioned the work that they've done with Canadian Observatory. Some of you may know them better as the Homeless Hub. If you've ever connected with the Homeless Hub, it's an absolute IT vault of tremendous information around the world of homelessness, all things homelessness. So if you haven't connected to it, I would suggest that you do. But I was looking at a lot of their information and research. I mentioned some research that was done locally. That is the on the right-hand side of the screen where you see, assessing youth homelessness in 3 Alberta cities. That particular research project was very eye-opening for some of the things that we needed to look at. There was another project out of Kingston, Ontario at the time that I was spending a lot of time with. And then I was also doing some just personal consulting with people from the Youth Hub and trying to learn from them what struggles they were having and why. And it was about that time that I came across the TAY research. And if you haven't heard of that, TAY stands for Transition Age Youth. It's become a very well-known research study out of Los Angeles. Dr. Eric Rice from the University of Southern California, along with multiple partners, engaged in this extensive research project where they interviewed over 700 homeless youth in the Los Angeles area. And the whole gist of the research and the whole outcome of the research was that they were able to identify 6 core predictors that would suggest that if proper intervention and supports were not put in place, that these youth would be likely to end up experiencing long-term homelessness. And that was defined by a period of 5 years or more. And as you see on the screen, what the 6 core predictors are, I don't know, there may be some people who are on the phone and not on their computers. So just to read them out, they were ran away from home, group home, or foster home, violence at home between family members, religious differences with parents or caregivers, first marijuana use at 12 or younger. They were incarcerated before the age of 18, and they either were pregnant or had gotten someone pregnant. And those were that was very eye-opening to me, and it really helped to frame this idea of thinking about sort of the preventative aspect. Okay, so if we can understand what the predictors are, then we could do some things and put some things in place that would actually help these youth experiencing homelessness or at extremely high risk of homelessness, help prevent them from becoming our chronically homeless adults that are in our Housing First programs now. And that's what started making me begin the thought change or the paradigm shift around what priority or what youth are the priority when we look at Housing First for Youth type programs and so forth, or the priority that we need to focus our efforts on. And it different than all of the deficit chronicity based concepts. And so I set out using that research as the core foundation to create a fairly short assessment tool. And it contains 17 questions to begin with. It was done through an Excel platform and based primarily on that TAY research. And there was scoring involved. And those scores that were created gave us a score regarding the immediate risk of homelessness, a risk of long-term homelessness, which was the key thing, but then also a score around prioritization. And then we also had separate measures around mental health and trauma. And as part of that, besides the TAY information, there were some areas that, from all of this other research that I did, that I felt needed to be enhanced and that we needed to identify a little bit more clearly. Some of those were things like FASD factors, gender and sexual identity issues, ethnicity, and then a little bit more around addiction and mental health and legal concerns. But even though there were scores involved, the whole point of the tool was that eligibility for a program or services or supports was not based on scores. Instead, the scores were designed to just help assessors compare one youth to another based on who they were dealing with at that point in time. And so there were no cutoffs, if you will. That might be a better way to describe it, that we did not say that if you achieved a score between A and B, that meant you were appropriate for Housing First, or a score in this area meant you were appropriate for something else. We did not want to make decisions about youth based on them being a score. We wanted to be able to facilitate a process where we could better look at that individual. And so just as a side note for now, what this tool originally was now sort of functions as our current pre-screen in what we use today. And now, so to go on, this is about the time that I don't know who entered stage left, whether it was me or whether it was David, but since we're talking about a government body, I would say they were probably already there and I entered from the side. And but David and his team at this time presented their Alberta plan to end youth homelessness. And as I read that plan, I saw the focus and the desire to have a youth specific assessment tool and process. And so what I did is I actually went and approached David and shared with him that I had kind of already started this process, that I had an initial version of a new tool that was youth specifically focused, and sort of picked his brain to see if he thought that might be of interest to explore as part of their plan. And so fairly quickly, we struck up a partnership and started to do some work together. And as part of that work, there was what do we call it? There was an advisory group, a working group that was put together to take a look at the existing tool, offer suggestions, give input as to what's needed, give input as to what hasn't been working, and so forth. And so technically what would happen is we would sit and we would talk with that working group. I would take their information and go back and kind of go to the drawing board, and then we'd bring that back together. David and his team would review stuff. They'd provide their insight and guidance and so forth. And they created a bit of an evaluation process and all of these things. And eventually what we did is we came to the determination of what the new tool should look like. And I put that together, and the group approved of it, and we entered a testing phase. And what that tool ended up looking like is actually it evolved into a full interview. And so the elements or components of that initial tool that I shared already were lumped in with a whole bunch of strength-based, positive youth development kinds of focused questions for an interview that we could go through. And that interview would also generate those same scores that we had talked about before, but it also helped us to identify specific strengths and specific risk factors that might be at play for that youth. And so the scoring was automatic. It generates automatically. It calculates automatically. And again, we had the immediate risk of homelessness, risk of long-term homelessness, prioritization, mental health, and trauma scores. But then in addition, we added 5 narrative domains. And those are the headings of the domains that you see there: housing needs, social networks and connections, health and wellness, daily living, and attitudes and behaviors. And the interview was designed to provide an assessor the information that they needed to then inform these narrative domains. And each of those narrative domains is scored from 0 to 3 and are based on the rationale that the assessor plugs into each one of them. And then they determine the score based on that. As I said, you also, as you went through the interview, the idea was to identify specific strength and risk factors. And as people would plug them into the boxes, it would automatically generate at the end of the assessment a master list of strengths and a master list of risk factors, so that it was all pulled together in one package. And then the last piece is another narrative, which is the final narrative, but it's the summary and recommendations narrative. So all of that is looked at and pulled together, and from that the assessor writes. And the best way I describe it is as if the assessor is now a lawyer in a courtroom. They've gone through the whole case. They've looked at and showed all of the evidence that they have, and they're now getting ready to stand in front of the jury and provide their closing argument. And that's what this summary and recommendations component is it's the assessor's closing argument as to, based on everything we've gathered here, based on what the youth has told us, based on what the youth wants, and so forth, here is our recommendations for referral and for supports that would be helpful. And it's important to note here that the way that the tool sits now in the training, we ask people to make sure that the youth signs off on what that summary and those recommendations are before they actually move forward. So the youth needs to approve of what they're recommending for them. And so here's the kind of the breakdown of the scoring, and as things have changed over time, we've eliminated some things. So the immediate risk of homelessness, we've taken that out, and I guess the biggest reason that we took that out is because it's kind of obvious, I guess, if somebody has an immediate risk of homelessness. So that's no longer there. We have the risk of long-term homelessness, and the long-term homelessness piece is what kind of identifies somebody that would likely be more appropriate for an intensive case management program. And so that score is out of, and because there's two pieces now, there's a pre-screen and a full interview. It's out of 50 in the pre-screen, but then total it's out of 53. So that's why you see those numbers there. There's a prioritization score, and from just the pre-screen, the prioritization is out of 122, and then it's out of 127 for the full assessment. The mental health and trauma pieces are built in a way that they help to inform both the risk of long-term homelessness score and the prioritization score. But I also felt it was important that we identify separately where they're at with mental health and trauma. Now, this is not any kind of a diagnosis. This is the mental health piece is really a mini mental health, and the trauma piece is just some very quick questions to help identify whether there's a possibility of and symptomology of PTSD. And I mean, we know that there's likely always going to be some complex trauma associated, but we really want to be able to have a flag if there's some immediate and recent or current symptoms of PTSD. And so it helps us understand the possibilities of that and gives us some red flags potentially. So we have those scores separated out as well. As I said, there's the narrative domains. Now, for those of you that can see the slide, it says see handout. I actually will forward to Eric and Darla a handout that describes the narrative domains a little bit further. But as I said, there's scored 0 to 3. 3 is a higher level of concern or complexity or challenge, and 0 is basically no concern. And this allows for trained assessor insight. Now, what I will also say, when we look at the summary for recommendations and the strengths and risk factors and so forth, this is now where they're taking all of these scores, they're taking the domains and the narratives of the domains, and pulling together that closing argument, that rationale for recommendations. But it says here, it's also pulled from the responses. And so this is the interview piece, right? So the way it sits now is there's a pre-screen, and that was something that came out of the the testing phase with through the government of Alberta was we realized that the interview alone was too long, and we needed also a way to be able to have a quicker concept or ability to assess some things in the immediate. And so we determined that a pre-screen was really important. And so essentially we've pulled the pre-screen out of that. And so there's a total of about 63 to really what it boils down to is there's 22 questions in the pre-screen and there's 45 questions in the full interview. But the thing I want to point out is that the questions in the interview are not questions. The questions in the interview are at this point just guiding suggestions for areas to probe and to explore. And so in a lot of ways, the interview process fits very nicely for people who already have in place a process where they sit down and have a conversation with that youth about what's going on for them and what they need and what they're experiencing and so forth. And so that's really what the interview aspect of this tool is about. It's just facilitating that conversation that most organizations are already having. So now it provides a more formal way to gather some information that is very strength-based associated with that. So the current version, then the way it sits, we have the pre-screen, 22 questions. They are all mandatory. The pre-screen is much more like what you would see as an assessment tool, the way it feels, the way it's delivered. There are 22 very specific questions, again, based primarily on the TAE research with some additions and adjustments and so forth. It takes about 15 minutes on average to complete. But, sometimes you have youth who are ready to talk. And so it might take longer for some. And you might be, getting a little bit more insight from some of the youth that you're talking to. And again, the scores are automatically calculated. But from the pre-screen now, the only scores we get out of that are the risk for long-term homelessness and prioritization. And so that gives you two numbers to help you in the process of comparing one youth to another if you need to determine who might be most appropriate to go first onto a caseload or to be connected to a particular service if there's a wait list or if their caseloads are maxed out or whatever the situation is. But those scores are not meant to make somebody eligible. And then we have the interview, which is called the YAP SR, 45. That's why I say guiding questions, and they are flexible. There's only 2 questions in the interview that are mandatory, and that is the 2 questions associated with the mental health and trauma piece, because those also contribute to the scoring. They're designed, the interview part is designed to pull out strengths and risks and to also help the youth feel like there are possibilities and like life isn't so bleak. And it takes anywhere from a half hour to 45 minutes, but again, depending upon the youth. But the point is if it's taking longer and the youth doesn't want to continue, then you don't continue. You just wait until a more appropriate time and you move forward when it's more appropriate, when it's conducive for the youth and the program or whatever. Again, the scoring, all of the scoring as part of this is calculated automatically, basically. We still have the 5 narrative domains, but there's been an additional domain added that is just for information gathering. So it's to incorporate things like information you would get from other professionals, or maybe there are other assessments that exist that might help to inform some of the decisions and your final summary and so forth. But it's just an information gathering domain. So there's not a score associated with it. And so that's what the domains look like. And the scoring, the way it sits, is just what I've described to you already. You have your summary, recommendations for referral. That all comes out of the summary of the domains, the summary of scoring, assessor's insight. And when I do the training, I say, yes, you actually do get to use your gut with this, and you do get to provide that insight. However, that insight has to be based on the evidence that you've gathered, not just strictly on a guess or opinion. And then within that summary, you'd provide your indication and your rationale for what referrals and things you're making. You have a list of strengths and risks, and that's essentially it. This is the training in a nutshell. It's a 2-day process, and the first day is primarily sort of the theory behind assessing youth and behind assessing youth related to homelessness, understanding what needs to happen and what needs to be in place. I will tell you that assessors who use this tool cannot be people who have just been handed it to. I don't know how you say that. You can't just have the tool given to them and think that they can go and do this assessment. There is an important skill set. There's not credentials that need to be there, but there is a skill set that needs to be there. But more importantly than the skill set, because that can be trained, is a value set. And we talk a lot about the values that need to be in place for someone to be able to properly assess youth in this way. And the struggle that I was mentioning before that some people have to kind of wrap their heads around is that even though they don't want a tool that says I check all these boxes and the tool tells me what to do, when they first go through this tool and they see that, wow, I actually get to and have to use my brain, and I have some say in informing how this plays out, people get a little bit freaked out at first because they feel like there's a big weight on their shoulders. But once they understand it, they realize how freeing it actually can be, and that you can open the doors necessary for a lot of youth that would otherwise not have had those doors open for them. So that's kind of the first day of the training, and we actually talk about the pre-screen there. And then the second day is more about the interview part, and then also the practical component of it. There's actually role playing in performing the assessment, and and then having discussions around what works, what doesn't, what feels right, and how best practices associated with delivering that type of an assessment. So, and then along came making the shift. What I will tell you, I didn't mention this before, is that when the original version of the tool was introduced to that system in Lethbridge, they used it alongside of the existing tool. There was, even though that centralized intake program was expressing some concerns about the existing tool, there was some skepticism actually about looking at this new tool. But in very short order, they ended up determining that this was a much better fit for them. And so now that as the tool has evolved and developed into what it is even leaps and bounds better than what it originally was. And I'm very excited as I watch people that I train sort of have the light bulbs come on and feel like this is an opportunity for us to actually have an assessment that is directed just for youth, and that it promotes possibility and growth and hopefulness, as opposed to the bleakness of what homelessness looks like. So I will end there, and we can deal with things through questions from this point.
Fantastic. Thank you very much, David, Wally, both. Really appreciate the information. What we'll go ahead and do is take a moment, and if folks have questions, please go ahead and submit them into the question box. And I see that we actually have several in here. So I will go ahead and tackle through these as they come in, and also check here on chat, and then give folks time to get a bit of reaction to sort of see what folks think. So the first question is whether Wally and David will be at the NAEH conference and sharing this tool with folks there. Gentlemen, are either of you going to be at the National Alliance on Homelessness conference in LA?
Unfortunately, I'm not. That's Dave speaking.
Yeah, and at this point, yeah, I wasn't going to be there. Actually, I'm not. I don't even remember for sure now what the dates are for that.
Right, coming up in just a couple of weeks.
Yeah.
So I'm thinking.
I think my problem was I was already booked out for some other trainings. So, yeah.
Sure. Okay, we will go ahead, and the follow-on question to that is getting in front of HUD and RHY programs, and we'll be working here from the network to continue to get this out more formally to share with folks, particularly at HUD, HHS, and other federal agencies, including U.S. Interagency Council on Homelessness.
One thing I should add, Eric, is that getting it out in front of policymakers and legislators and those kinds of things is going to be far easier following the validation process that we're currently engaged in with the University of Ottawa. And so that was one thing that we wanted to make sure would happen, not only in conjunction with the Making the Shift project, but also simply the work around grounding the assessment tool in good, solid, evidence-based research. And so once we have that, that becomes a much different conversation. I respect the goal of getting out in front of people, but also we want to get the so what out in front of people as well, and have a seal of approval with respect to the tool that we can anchor our conversations on with those folks. And so that isn't a long time down in the future, but I think that's going to help us in emphasizing the importance of the tool within those conversations.
Fantastic. We have another question here specific to the assessment, which is, does it include commercial sexual exploitation identification as a risk factor?
Yeah, so there are elements that, like part of the interview, there's some specific areas that you're prompted to be asking questions around, their exposure to violence and abuse or being hurt and things like that. And so, the nice thing about the tool is that, and I'll tell you, one of the challenges originally there were the strength-based questions and the strength-based interview was made up of sort of designed questions. But one of the things that became very clear right away is that people became stuck in feeling very prescriptive about those questions. And even though they had the freedom, and were told they had the freedom to shift the wording of the questions and so forth to be a better fit for either that youth or that particular subpopulation of youth or whatever, it was very challenging, because if people saw a question written out, they felt like that's what they had to ask, and it was causing a challenge for them to be a little bit more flexible and creative. And so that's why it's now moved to and actually what I've created now and as part of the appendix of the training manual is just an interview guide. All it is it's taken all of those components that are part of the interview and broken them down into just topics. And it just provides a guide for them to look at so that it can prompt them to explore those different areas. But that is one of them, but it doesn't specifically say explore sexual exploitation. It talks about exploring, things associated with victimization or violence or whatever. And then, of course, that allows the assessor the freedom to go wherever that takes them naturally and organically in the conversation.
Great, fantastic. we have a few questions here about the review and validation, including when you will anticipate having validation completed, and also whether this includes human subject certification.
Yeah, I was worried someone might ask that question, so I'm frantically trying to pull that up of our timelines for that, and I can't find it. We'll communicate that back to folks, and yes, it does include human subject.
Great. So we'll be able to share factoids.
Sorry. What I can tell you is, just because I've had to have some direct communication with the folks that are doing the validation. And yeah, there's going to be, I believe, if I'm not mistaken, I believe that it's a 6-month process.
Yeah.
But there's going to be, participant focus groups. They're going to be going over assessments that have been done with actual participants. And then there'll also be comparative tools used as well, or comparative measures from other instruments and so forth that do similar things, so that they can validate that compared to them. But absolutely there is, and also when you talk about certification, when we do the training, when I do the training with people, it's considered a train the trainer, but I need to kind of qualify what that means, because I don't want people to have to continually have someone like me come back and train everybody that's new to using it. And I don't think it's the type of instrument that would need that anyway, as long as there is somebody already in existence that has a good understanding of it, because it is much more than just asking some questions and ticking some boxes. So the certification process comes after the training, and what I ask people to do is they need to conduct, each person who's going to be using the assessment tool needs to conduct 3 full assessments where the pre-screen and the interview are done, and they need to do it with a secondary assessor. So there's 2 people sitting there doing the assessment, and the whole point is that then they compare notes afterwards for consistency and all of those kinds of things, which also will play a part in that validation process. But it's also about just generating consistency and understanding of the tool amongst your staff. And so 2 of the 3 of those assessments that they need to complete with a co-assessor have to be done with a different assessor, a different co-assessor. So at least 2 of your assessments, you have someone different sitting with you and comparing notes. And then there's a form that they fill out describing, their results and their feeling about that particular assessment. They send that to me along with the completed assessment. And as soon as I get 3 of them from an assessor and review them and feel like things are okay and that there's not any red flags, then I give them sort of my stamp of approval saying, I'm good with you now, even doing sort of on-the-job training if you've got a new staff person that's going to be doing those assessments or whatever. But I just want to make sure that I feel good about how they're administering the tool before we tell them that they're cut loose to go ahead and train their own staff.
And that does bring us to one of the other questions here, which is really just wanting to affirm when in the process and who are the youth that are being assessed? Would that be through street outreach? Is it when they present to coordinated entry?
It's a great question, and I think the beautiful thing that we're seeing about the tool now is that it could be, and David kind of spoke to this earlier, and you might want to enhance your comments a little bit, David, but about the idea that virtually any system that is dealing with youth who are experiencing homelessness or at risk of homelessness, or are at risk at all, that system could use this tool to help them in making decisions about, service provision and supports and referrals and those kinds of things.
Yeah, and so specifically around the how the tool is being applied within the validation process is the two streams of programs, if I can call them. I've got my fingers going as air quotes, streams of programs where youth are being the assessment is being used is through Housing First for Youth, but also a program model in Alberta called Family and Natural Supports. And so young people who are in need of an enhancement or focused family intervention or supports for connecting to natural supports once they're housed, or even if they're at risk of homelessness, but then also those young people who are being housed through Housing First for Youth are being assessed using the YAP tool. And so that's the evidence base. Those two program streams are going to be providing the evidence base for the validation process.
My belief, though, is that every youth system of care should have a coordinated entry approach of some kind, so that regardless of what the youth situation is, there is that sort of, as David said, that either no wrong door or that pathway that everyone knows this is where we need to connect to youth, or where we can connect to find out about help for a youth, or a youth's family can get help, or whatever it is. Mm-hmm. There should be that coordinated piece there. And so if you have that, then yes, this to me would be an ideal place to have this tool be incorporated.
Well, and if we're allowed to dream, which we sometimes are allowed to do, this tool, in my opinion, should be applied and should be used for every young person a year before they transition out of child intervention or child welfare. Yeah. And then 6 months before they transition, the tool should be used again to determine where those elements need to be focused on to prepare that young person for transition. So that's just a really simple application of how the tool can and should be used to ensure that young people who we know are overrepresented in the homeless population, we can get a better sense, and I put myself in the we as a service provider delivering child welfare or child intervention services, can get a sense of what areas we need to work on so that young person transitions into adulthood or transitions into independence effectively.
I will tell you a couple of other examples of where it's being applied and where people are wanting to apply it. People are talking about, like, I know there's an organization that operates a system of foyer model housing for youth, and they're talking about how they could see this really being applied in that specific system. We've got people talking about using it in shelters as sort of a first line of approach with youth that are coming into shelters. We even got people talking about the application of it in schools, where people in a school system, when they recognize that there might be things going on or whatever, that they could use this tool right there as another preventative measure. Mm-hmm. And then, of course, Housing First systems of care are looking at and using it, and sort of the list just kind of continues to grow.
Great. And one of the questions related to that is how you have made the transition from crisis response in the cities or provinces that have been implementing this, and what the response has been from CBOs and coordinated entry systems to the tool.
Well, that's also a good question, because it's still very preliminary. Like there's tons of interest. There's lots of people now who have been trained and who are starting to implement it. There's a few programs who have been using it. The biggest response that we've gotten so far is, again, just appreciating the youth focus, appreciating the focus on strengths as opposed to deficits, and feeling that level of hopefulness. And so that it's about building on what's already there and what the possibilities are, as opposed to feeling like we're always focusing on how are we going to fix this problem. And so in that sense, the tool is very trauma informed, in that we're looking at, what's happened in the youth's life, as opposed to what are the problems that the youth has and what's wrong with them. And so that's kind of, I think, how it's shifting things away from that crisis response, that deficit response, to more about building on resiliency and existing skills, or even, and it's interesting, we talk about what strength-based is, and there's some great research out there about that. We often think that a strength-based approach is about what we're good at, and that's not necessarily true. That in a lot of ways, it's more about what keeps our focus and what draws our attention, and those kinds of things as well. And so there's a lot of the strengths that are there and existing for youth that they don't even know or understand. And so that's a big part of this, is they, I think, walk away feeling more hopeful themselves as well. And so if you feel hopeful about something, you're not so focused on what the problems are. And also it allows us to be more preventative in nature. And so we're, as I said early on, prioritizing youth is different. We're not prioritizing youth so much based on, they are if we've got a youth who's got some major health problems, which would be a rare occurrence, but if they do, and if they're not going to get help, they're probably going to die on the street. Well, they are obviously a priority. But otherwise, for the most part, we're looking at things like, what's going to happen if this youth doesn't get supports, and what could happen better for them if we do. And so that's a very different approach than sort of dealing with just crisis.
So a related kind of question, and in terms of next steps, we've had a few folks here who have asked sort of where this is being used. Are folks looking for pilot sites, and how much training would cost? So I guess to sum that up, how could folks here in the States who are looking at opportunities to utilize this get more information and take those next steps about implementing the YAP tool?
Well, it's really not that complicated. Just if you're interested and in the training, let us know, and we'll connect, and we'll see if we can work it out. In terms of time, I think where it's being used already is, there's places in Toronto, there's places in Alberta, there's places in there's an organization in Newfoundland that's using it. There's multiple, there's going to be places. There's a program in New Brunswick, so it's expanding. There's interest, growing all over the place. But I think it's important to understand that there are a couple of things that we do require, and one of those is that we want, if you're going to be trained and if you're going to utilize the tool, you need to know that we're going to ask for your data. We're going to ask for information based on your usage of the tool to just continue to help us inform and improve and continue to develop it and make it better all the time. Every single training I do, there are adjustments that I make to the training process and the manual, and improvements that are made. So we're very open to that and want that to happen. But David, you're going to make a comment, and then I can mention basic costs.
Yeah, the only comment I have was, given the strength of the network, your network, I think we work with Eric and Darla to come up with some innovative ways to think about how to sort of capture a number of communities at once, and we can be strategic and creative that way. And so it's an opportunity for us to continue to collaborate with yourselves, but then also recognize the demonstrated need at the community level. And so we go ahead and talk about costs, but let's try to be creative about how we do it.
Yeah, for sure. And it's also important to know that with this training, because of the practical component, because of the sort of the role playing and trying to go through the tool with people that are there in the training with you, if you get too large of a group, then that becomes challenging to do that piece justice. And so that's one thing that we would want to think about, is how many people it is that are there. The other thing that I like to also consider, and it's not a roadblock by any means, and it's not something that can't be dealt with, but sometimes in the training we have significant discussion specifically about how this is going to play out in their system or in their programming. And sometimes if there's a large enough group of people who are using it in different ways, that can then be a little cumbersome, because you can't necessarily do certain people justice. So all I'm saying, I guess, is that we would just want to make sure we talk about how large of a group it is, and make sure that it's something that's going to be value added for everyone because of that. Also, we would want it to be in a space that would allow for us to do, we break off into groups of 3, where there's an assessor, an observer, and a client, right? And so you want to be able to do that without being too distracting or disturbing to other people. So, but as far as the costs go, I have to think American as opposed to Canadian, but generally the basic costs are in Canada right now are $1,200 a day plus expenses, and it's a 2-day training. And so I believe that depending upon what the exchange rate is on any given day, that roughly works out to $1,000 US a day.
Okay. And as point of clarification there, you mentioned the sort of breadth of locations throughout the country that it's being utilized. It sounds like it's being utilized in larger communities, suburban, rural settings. One of our questions here is, what folks are asking is, has this been used and implemented as a community-wide response, or is it largely still focused within specific service individual providers?
Well, my first response to that is that I think that that's an ongoing challenge, no matter where you are and no matter what tools are being used. I don't think there's enough of a community-wide response happening. Originally, like I said, when this tool was originally created in my community, it was a community-wide response, because that youth centralized intake was the place. That was where any youth who were at risk or experiencing any level of homelessness or whatever, that's where they would be connected, is through there. That was the starting point. And it didn't matter whether it was a youth coming into their office or the mobile team going out to connect with that youth wherever they were. But that was the organization of where everything began, and the community understood that and accepted that. But that's not necessarily the way it works in all communities. And in fact, there's a few communities that are associated with some of the projects that are going on now that they're struggling. There's a little bit of struggle to navigate how that works, because the existing system already has some other assessment processes in place, and now they have this other youth stream that's wanting to incorporate this tool into the system, and so they're having to have some conversations on how that works and how they parallel or whatever. So, if it can be a community-wide approach, that's ideal. David said, talking about dreams, but not everywhere is able to do that. And I think that's one of our ongoing challenges generally in the work.
Great, thank you. So we have one other one, which is how this compares to the TAE VI SPDAT by org code.
How it compares. Well, I guess one way I would say it compares is that the TAE VI SPDAT, the VI SPDAT was in existence, and then components of the TAE research were sort of built into it. But what I will tell you is the feedback I'm getting is people who have been using that tool still sort of feel like that it's not a strength-based tool, and it's not as youth focused as it could be or needs to be. And then also people feel very caught in the cutoff scores associated with that. And so having the score kind of make the decision for you. So that's, but again, the TAE is, if you want to compare the TAE to the full YAP, where you're looking at the pre-screen and the interview, the TAE is going to be much quicker. The TAE would be more comparable in time to the pre-screen. Mm-hmm. But the TAE does not contain the ability to sort of have this supportive strength-based interview process that allows you to, kind of gather and inform the domains associated.
Great, thank you. I think that we've basically covered a combination of everything that folks have asked. We had a few that were you managed to tackle that came in different streams, and a few that were multiple of the same questions. So I think that kind of finishes it up for Q&A. Any closing words, Darla?
Yeah, I want to thank David and Wally so much for their time and partnership. We are really excited to be working with them to help get this out across the U.S. And we are really hoping to find some creative ways, whether it's some regional gatherings or what makes sense for these trainings to take place here in the U.S. And we'll definitely be sharing. We've recorded this webinar. We'll share the handout. We'll share the answers to the questions that they'll be getting to us. David, I do think you are coming to the National Network for Youth Summit next month, correct?
Yes. Yeah.
Awesome. So you'll definitely can harass David. Wally, you're not able to make it, right? You have something else?
Yeah. No, I'm part of that is Mexico. That's part of what I have. So.
Yeah. Awesome.
Acceptable.
So David will definitely be at our summit next month. And folks will be able to they can stalk him as we do here. I was, Wally, the person behind the tree with the camera, by the way. I wanted to just confess. So you'll be able to get some FaceTime with David, though not Wally. Wally will be in Mexico. And definitely know that you'll be hearing more from us about the great work from our partners in Canada. And Wally and David, any closing remarks for the good of the order?
Maybe I'll go first, let David have the final word. But the only other thing I just thought of that I would like to add about the training is that, again, when you think about that process of having to do an assessor and a co-assessor for that certification process, you should think about then that you should have probably at least, well, for sure 2, but you probably should have 3 people from an organization be part of the training, right? Right. So that you can have the right numbers to be able to make that happen.
Yeah. As far as final words for me, I want to thank Darla and Eric for making this happen. There's the work that you community partners are doing at the ground level is entirely complicated and sort of precarious and cumbersome and all those things. And what we hope we can do with the tool is smooth out some of that. And, I want you to continue to be innovative and continue to be creative and continue to look for partnerships and ways that we can better support young people. And if one of those ways is the app tool, then we're really excited about that, because I do think there's opportunity here, and we're really just knocking off the top of the iceberg at the moment at the opportunities that exist with a tool that can think differently and allow you to work differently. So I appreciate your time, and I appreciate your commitment to this work, and we'll be in touch soon.
Well said. Totally agree. Thanks, David.
Yeah.
Thanks, David. Thank you, Wally. Thank you, Darla. With that, we'll conclude our webinar. Thank you, everyone, and have a wonderful afternoon.
Take care, everyone.
Take care, folks.